Hello and welcome back to another episode of the 2020 podcast, Canada's #1 optometry podcast. I am your host, Dr. Harbir Sayan. Thank you, as always, guys, for taking the time to join me here to learn and to grow. I'm always so grateful for the support. If you listen to the podcast regularly, you know I'm saying this off the top of every episode, but I'm truly, truly so grateful. All the messages, all the comments, all the in-person, conversations that we have about the podcast really keep me energized and enthused about bringing on amazing new guests so we can keep growing the podcast, but more importantly, keep growing the profession and strengthening the profession. That is really the goal of the podcast. And so to help do that, please, if you get some value from this conversation, share it with a friend, with a colleague, send a text message, put it on LinkedIn, put a photo up on Instagram, whatever you can do to let people know that we're having these conversations. And today's conversation is really, really going to be an important one. A couple of weeks back, not very long ago, I released a 2-part series on the topic of scope expansion with some amazing guests, right? We had Dr. Shaina Nenzi, who's the president of the OAO. We had Dr. Sophia Leung, president of the AOA. Oh gosh, I'm going to mix up all my letters here. Dr. Evelyn Lowe, the president of the BCDO, and Dr. Sarah McIver from the University of Waterloo, to talk about why is scope expansion important. What does scope expansion even mean? What are we asking for? And today we have a surprise third episode to add on, a bonus episode to talk about scope expansion, plus a bunch of other very important things. My good friend, Dr. Martin Spiro, who is the president of the Canadian Association of Optometry. He is the co-owner of a large group practice in Montreal, a 10OD practice. He also practices low vision at an interdisciplinary rehabilitation center in Montreal. He's an amazing guy. He's the president. He is El Presidente. He is the guy who is at the top of the pyramid right now, and he's a great guest on the podcast, returning guest. It's really good to have you back, Martin. Thank you for being on the podcast.
Thanks so much for having me. It's super wonderful to be back. You're doing such an amazing job with this podcast, and I'm a big fan. So always happy to just have these conversations with you, either on or off the podcast. It's always super engaging. So thanks so much for having me.
I appreciate that, man. It is always so good to catch up with you and chat with you, whether it's online or offline. In person is always the best, in my opinion. But in any case, to have you back on the podcast is great. And really to have you on to talk about such an important topic. It is, I'm learning week by week here how important this discussion really is. At first I thought, well, in BC, we're asking for scope expansion. Then I learned, well, Alberta is also asking for scope. And then I learned, well, Ontario is also asking for scope. And then I learned that last week, this very important meeting happened, which happens every year, called the Optometric Leadership Forum, which is hosted by the CAO as a platform for leaders in Canadian optometry to discuss current state of optometry and the future of optometry. I know this meeting happens every year, but I learned that scope expansion was actually the core topic of discussion at OLF, which really tells me that this is a national issue, not just a local or provincial issue. So I'd love if you could tell us, please, first, what is OLF? Because I'm sure there's some of our friends out there who maybe don't know too much about it and the value of it. And then let's dive into scope. Why was scope expansion like the key topic of discussion at OLF?
Yeah, great. Yeah, no, it was a super exciting meeting, and it's a little bit to touch on OLF. It's a meeting that the Canadian Association of Optometrists have been hosting for many, many years. In fact, my first OLF was actually when I was a student representative at the University of Montreal, and I was invited at the OLF to represent the student voice, and I was super impressed that this kind of meeting existed, where you're seeing leaders from across the country, both provincial presidents, but also presidents of colleges and regulatory bodies, schools, the student voice. So it's really one of those moments that made me want to get involved in Canadian optometry and the association world, was being at that type of meeting as a student. And since being on CAO, it's really been such a unique and wonderful way to get leaders, both from the association side, the regulatory side, the academic side, the student side, to all come together and look at some of the issues that are facing our profession, hear from experts both within and outside of the field, and have open discussions about how that could impact optometry. And the last 2 years were kind of a mix of teleoptometry and artificial intelligence. And for listeners who are, members of CAO, which hopefully they all are, if you go onto your member login, you could actually read the summary reports from the
Oh, that's
last
good.
Optometry Leaders Forum and see how, what the kind of consensus paper was and the discussions were on those issues of artificial intelligence AI. So we open up the OLF, feedback and summary as a whole to membership at large. So if you haven't checked that out, do. It's a super interesting report, and we've actually gotten hailed from all the guests on how pertinent it was as a summary. But yeah, this year you touched on it. Great. It was on scope optimization and modernization.
Yeah,
So,
apologies. I'm
all good.
using the incorrect term here. I
Yeah.
should know better.
Yeah.
Right. Scope
So
modernization and optimization. Okay, please.
yeah. So, when you talk about scope expansion, I understand that we're looking at, expanding what optometrists do in clinic. But just to take a little aside, if we really look at what a lot of these scope proposals are talking about, it's really optimization, modernization.
Right.
It's
Right.
involves techniques that we all are familiar with, using a slit lamp, using devices, treating chalasia, treating glaucoma. These are already things that are in our wheelhouse in a primary care and optometric practice setting.
Yeah.
If I look at scope expansion during COVID, okay, in Quebec, where I was, because there wasn't enough nurses, doctors to provide immunization for COVID vaccines, they expanded scope to optometrists and other professionals to do vaccine immunization. So
Hmm.
that's really something that's, outside of optometry scope, is,
Mhm.
giving immunization vaccines
Right.
for upper respiratory tract infections. And, that I would consider a temporary or scope expansion, because that's really going outside that scope. But, in this case, when you talk about BC, Ontario, and Alberta, and even Nova Scotia, Newfoundland, so we got about
Mm.
half the provinces that have
Right.
active scope proposals on the table. It's really more of an optimization, making sure that patients have access to proper treatments and proper timing, and utilizing optometrists to the highest extent of their education and training. So yeah, it's more modernization than anything else, I think. So
Yeah. I gotta before we move on, I apologize to Dr. Evelyn Lowe because she just yesterday, I think it was, I was chatting with her and she's like, let's make sure Harbier we're saying optimization and modernization. And here we are right off the top. I'm using the wrong phrase. I apologize, Evelyn. Please don't be upset with me. But honestly, I believe that too. It's not I'm not doing that just because I've been told to say those words. But honestly, when you look at it, you're absolutely right. And if you go back and for anybody who's watching or listening, if you haven't listened to or watched those previous episodes, you'll understand why. And I mean, Dr. Spiro just mentioned it as well. But when you look at what some of the provinces are asking for, it is not modern. Excuse me, it's not an expansion. It is simply just catching up. You know, Ontario, for example, cannot prescribe Xiidra just based because it's not on the list, because that drug came out just shortly after they were given a list, like one page. Here's a list of drugs that you're allowed to prescribe. It's not on that list, so they can't prescribe that, which is now has been on the market for like 10 years or whatever it has. In BC, that we can't prescribe orals, which is definitely behind the times based on what most provinces and states in the US can do. So in that scenario, we definitely are talking about catching up, modernization, and optimizing it. I think optimization is a good word for the healthcare system and for our patients to receive the best outcomes, best medical outcomes, right? And receive access to care. So yes, I think it's very important we use the correct terminology. I'll let you take it from there to
yeah,
continue,
yeah,
please.
and so we looked at all that, and it was a great event this year, particularly because we had such great speakers and guests, and we had an incredible Canadian panel to talk about what's the landscape in Canada, including guest speakers and representatives such as Sophia Leung, who kicked off our session along with Rich Castillo from the US. So looking at kind of, what is the landscape now in terms of workforce, ophthalmology, patient needs, and I know we'll get into a little bit of that soon. And then the next day, having these discussions with leaders from across the country, including Dr. MacGyver, who I think did a great job on your podcast, along with Sophia, and Kim Bergera from Alberta, Justin Boulay out of Newfoundland as well. So and Mark Wildo from BC. So having that Canadian aspect was where all these scope proposals are happening was super interesting for the group to hear. But we've also invited a panel of our US colleagues out of states such as Louisiana, Kentucky, and California.
Oh, interesting.
Where in the last, Kentucky having, these in-office optometric procedures available for many years, with Louisiana also having them after a few years, but a little bit more recent. And California, which had a scope proposal, which was, supported and passed, but at the last minute vetoed by the government, even though they had the votes, to really share the experiences and also learn where you have about a quarter of US jurisdictions, so now 12 states that allow for laser procedures and minor surgical procedures. So also understand how optometrists are embracing, integrating this into their practice and how much of a benefit it is for their patients. So having that perspective directly and being able to have those discussions with our counterparts in the US was super enlightful as well. And we also had some workshops that were organized by Dr. Lung, so that optometric leaders can, go through and touch, feel, shoot as well. Although many of the doctors that were there had done the laser and surgical procedure courses in the past as well.
Got you. Yeah. So we're going to talk about that because you've done it as well, right?
I have. Yeah.
So we're going to talk about that in a little bit. But so interesting the idea of you inviting guests from the states. I think that's so valuable, especially from states that already have these certain rights and privileges for certain procedures. Not only kind of learning about what their process was to get the approval and get it passed through government, but also like what has life been like since they have received those privileges now, right? And how many adverse events have there been, or how has the access to care improved? So we actually can see what is the benefit and what are the potential, I assume, limited pitfalls to optometrists getting that scope expanded and optimized. And so did you hear some of that as well from them?
Yeah, absolutely. I mean, it sounds super exciting and encouraging. And, we asked about, okay, so, a lot of these scope proposals are for laser procedures, and some of them are for, minor surgical procedures, such as removing chalasia from eyelids. And it was just kind of interesting to hear that, optometrists embraced kind of both. There's especially in more rural or settings, having those minor surgical procedures and office surgical procedures are very beneficial because, the investment and integration into their practice, you're not purchasing a laser, so integrating it into their practice, whereas to see sometimes an ophthalmologist could be hours and hours of drive away and delays, to practices that share a laser. So the laser may go from one practice to another every week.
Interesting.
Because you're looking at maybe some volumes where you may not need a laser in the office every day of the month. But you could condense all your procedures maybe in a few days per month and then share that with another office as well. So it was really interesting to see, the ways that this type of scope has been embraced by the optometric communities, and that the training of it. There's the school, optometry school in Kentucky. So now that is a jurisdiction where they have access to these procedures and also a training site. So really interesting to see how also it's really been embraced by the optometry students who really look forward to being able to treat their patients at the highest level available.
Yeah, that's amazing. That's excellent. I think that's the ideal scenario, is that students are trained in these things just as part of their curriculum. And so when they come out, this is just second nature for them, the same way as holding a 90 while in a slit lamp, or a 20 while you're doing BIO. It's I think that's the best case scenario. I mean, of course, there's many of us who graduated before some of this training was available, so we have to go back and do it. But it's nice to be at a school that's going to provide you that training, thorough training, that you come out just comfortable knowing that, and knowing how to do it well. And then coincidentally, I was messaging with student at Waterloo just the other day, and shout out to Yulia, because she volunteered at our office before she applied to Waterloo just a few years back. And so she was just telling me, coincidentally, she was like, "Oh, I'm just about to head into my advanced training or procedures course with Dr. MacGyver, and we're about to, learn about chalasia or whatever it might have been." And I thought, wow, this is so cool. A little bit of a full circle moment for me there. Here I am talking about on the podcast, and here I have a student who worked at our office who's going in to get that training done right now. So very, very cool. All right, so we've established, of course, scope optimization and modernization is very important, and the OLF is such a great platform or forum for our leadership to really look forward and see what is needed in the profession in our country to help our profession to grow. What about, one of the questions that I've been asked, as I've been kind of talking about the fact with a few handful of select people that we're going to have this conversation, Martin, is, what does the I think, when I think you and I spoke a while back, one of the questions in general that membership has is, what does the CAO do? And understandably so, because there's so many facets to what the CAO does. Sometimes we don't really understand what type of support there really is. But in this scenario, questions have been, how does CAO support in scope optimization and modernization? Because most of these battles are provincial, and of course CAO is federal. So how can the CAO support?
Yeah, that's a great question, and it's something that we have been active in a long time, from supporting the development of the laser and surgical optometric surgical procedures at the University of Waterloo, which you were saying your student colleague was attending. Well, so I'm going to give a shout out to Dr. MacGyver, Stan, and their whole team there,
Yeah.
on their course. So while it was in development, we were in touch and were able to support it. But then also at the initial launch of that course, we made sure to send our board to do these procedures, lead by example. We figured it'd be great to have Canadian leadership certified for lasers and procedures, as well as trying to ensure that we had as many people touching, having gone through this course as much as possible throughout the country. But beyond that, the CAO plays a very active role in supporting provincial associations with their scope proposals. And, whether that be sending letters to government officials if there's already something on, but even from the initiation and development of scope proposals. So CAO worked very closely with both BCDO and NSAO, the Nova Scotia Association of Optometrists, in constructing, collaborating, giving feedback on their scope proposals. At CAO, we have a government advocacy branch with a advocacy and government relations director, Bonnie Kirkwood, who's very active right now with these provinces in supporting their scope, as well as a research and policy department, which can provide real-time research and policy that shows, that these procedures, when done by optometrists, are safe and accessible, looking at workforce analysis of why it's so important that patients have access to this type of care when it's available and readily distributed by optometrists as well. So both on the government relations side, but also on the policy and research side, CAO is able to support, as well as getting grassroots efforts off the ground. So CAO also has grassroots advocacy training. And, it's very important that, not only is it coming from the association, but it's also coming from the members who are looking to get engaged with their local government representatives. Well, if you've never done that before, it could kind of seem a little bit intimidating.
Yep.
So CAO has advocacy and government relations training boot camp, where they could help you draft a letter to your local MP or government official and make sure that's in line with what would be best practices when reaching out, but also prep you for a potential meeting that you'll have with that, to make sure that you know how it goes, how much time you'll have, what are the critical points you want to get across, and help training in that as well. And that's available if you go onto the CAO website. In the member section, there's a little subheading called advocacy, when you could click that, and then it prompts you to send an email to our director of government relationships, and she'd be happy to set up a consultation that could involve template letter as well as advocacy training there.
That's amazing. Sorry, is there more? I want to stick on that.
No, yeah, let's. I mean, there is more, but let's dive into it.
Why don't we could put a pin in that if you want to tell me more right now, or we can, if you're okay to come back to some of the other.
We'll come back.
Okay, because the advocacy stuff, the grassroots stuff, that I wanted to just take a minute to really kind of put an extra point on that one. First of all, amazing that CAO has these resources, right? Because you're absolutely right. It is daunting. I'm about to reach out to a politician. I never really spoken to a politician before. I don't know what to say to, an MLA or whoever it might be I'm trying to connect with. I don't even know how to connect with them. How do I know my email is going to go through if I find their email address online? So there's a lot of questions in my head. And the fact that the CAO has these resources is amazing. Now, credit, I always like to give a shout out to our provincial association. BCDO has a lot of resources as well. So if you're listening and you're in BC, then connect with BCDO as well as the CAO. I would recommend you do both to get as many resources as you can. Really great that the CAO has that, and I commend them for having those resources. Now, the grassroots effort, that part is very, very important. And, you're right, absolutely right. It's one thing we could sit back as optometrists and say, well, we have an association for that. That's their job to go out and advocate for us. But there's only so much a large organization or a larger organization can do at their level. We can't expect that just going into whatever meetings you might be going into and throwing some big punches and getting the result that we want is going to work. We have to do more of a grassroots effort as well. And that includes all of us, right? This is part of us as being part of this membership and part of this profession, pulling in the same direction. And that's, sending out emails and having these conversations about scope optimization, and notifying, a lot of times, most of the time, our politicians don't know about this. And they don't know about our profession, and they don't know what we're asking for, and they don't know how we can help their constituency, right? And so it's important for us to just let them know, as maybe it's as simple as sending a template email, or, ideally it'd be a little bit more than that. And I'm going off on this little tangent here because I myself, I'm making an effort, because I know I can't just talk the talk. I got to walk the walk. So, if I'm going to say all this stuff on the podcast, I got to make sure I'm leading by example off the podcast as well. So this week I have sent out a few emails to a few different MLAs. So we live in Vancouver, but we have a practice in Surrey and we have a practice in Abbotsford. So I sent out letters to each of the MLAs that are representing those certain communities that our practice are in, or our house is in. So, asking for a meeting, asking to talk about optometry, asking to talk about scope optimization. And I'm hoping, maybe not by the time this podcast comes out, because this is going to be out in a couple of weeks, but, soon enough, I'll be able to report back and say, I had a conversation with such and such MLA, and we're trying to, help them understand the importance of this topic. So I would encourage everybody out there who's listening and watching, Canadians, of course, Americans as well. Advocacy is just as important in the States. Whoever you are, wherever you're listening, do your part, please. Get out there, advocate for your profession. That's the only way it's going to continue to stay strong and thrive in the future. So I'm going to step off my soapbox and give you back the mic, Martin. Any thoughts you want to share on that?
I'm happy to hear that. I think that's great. I think, like you said, we're working very hard at both the provincial and national level when it comes to advocacy, for awareness of optometry, eye exams, the importance of vision care. And, we at CAO, we were successful in passing Bill C-284, which calls for a national strategy. So as your associations are working very, very hard to advocate for eye care and optometry. But like you mentioned, government officials like to hear from their constituents, right? It's where their votes are coming in. It's people in their community.
Right.
So both are really important. So yeah, we're happy to, advocate strongly from an association level, but also provide the resources for optometrists to get involved in, having those discussions with their local government officials, and telling them what they're about, what optometry is. Like you said, many may not know what optometry does or can do, or what is available in offices, businesses in their riding. So that's great. And not only when we have active proposals on the table, but it's just good to stay in touch with them and stay involved as the profession develops. Having those even closer relationships before anything comes up is great as well. So
Absolutely.
absolutely. So commend you and everybody else who's doing the same. A lot of the provincial and national association have some great resources to make sure you're feeling comfortable. And speaking from experience, as someone who's had quite a few meetings over the course of my mandate as president, but even before that, just as an optometrist who did a lot of advocacy with government, the conversations are very supportive. Vision care is something that a lot of government officials like to get behind. They realize it's important. Either they have somebody in their family that was affected by macular degeneration, glaucoma, or they have kids that are part of the coming to close to 50% that are affected by myopia. So many of them have experience of people, either them or very close to them, that know the importance of vision care and optometry. So you'll find that these conversations are very supportive and with the government officials, and they are looking to both support you, but it's important, like you said, to show how you can support them and address issues. So
yeah, absolutely.
And
And again,
on that.
if hopefully we've gotten a few people fired up and excited to go out there and talk to their MLAs. And if you are, then please check out those resources to help you to be able to share the correct information and get in touch. In that part of that earlier discussion, you were mentioning workforce data. I wonder if you could share a little bit about what that means and what type of workforce data you have that could support the idea that scope optimization is an important move for optometry and for the government.
Yeah, absolutely. And, we could even look, it's important to kind of look at our past, right? If we look in maybe, maybe we weren't practicing, but, if we look 20, 30 years ago, what optometry was doing was quite a bit different. Many jurisdictions didn't have diagnostic drops for dilation. And I don't think any really had therapeutic privileges to treat, common eye conditions, conjunctivitis, viral issues as well. So, if we look at the evolution now, can we really imagine practicing optometry without, being able to dilate, being able to treat emergencies, remove foreign bodies, et cetera? Imagine if every single symptomatic PVD was being sent to the emergency room or ophthalmology, the system would break down. If every single conjunctivitis or foreign body or any type of ocular emergency was being sent to the ER or ophthalmology departments, there would be no capacity. So, this is in response to not only our training, but patient needs. So as we look at that workforce, and there was an article published in the Canadian Journal of Ophthalmology, which shows that the ratio of ophthalmologists to Canadian population is in decline. And, I think even in the article, it mentions, a reduction in residency spots in Canada.
Oh, wow.
But even more so, if you want to look at that article, is the ratio of ophthalmology to population over the age of 65. So if we're really looking, we as optometrists, we do primary care. We see, people from, 0 to end of life over 100. I think my oldest was, maybe 108. I think,
oh, wow.
That I had a patient in the past year. So, and my earliest was, a couple of weeks, right? So, we see that whole spectrum. And ophthalmology does as well. But looking at, as mentioned in that article, roughly about 2/3 of the care that ophthalmologists provide is in that 65 plus range. Right. And we see that in our own practice. It's pretty rare that, somebody healthy in their 40s or even 50s has, needs ophthalmology care. But, bump that up to 65 plus 70. And that's where you see, need for, cataract injections, these types of services as well. And if you look at that ratio, I think in the 70s, it was about 40 per 100,000 people over 65, and that's halved now to about 20. So the workforce of ophthalmology available for the senior population has declined significantly. And we don't have a population in Canada that's really getting any younger. We're also talking about the aging population, and so the demand for eye care is gonna go up. And as optometrists, we're the major source of eye care in the country. We're very well distributed. There could be improvements in certain rural regions, but generally, over 75% of Canadians have access to an optometrist within 30 minutes of their primary residence. So we're available. Our wait list for a general exam is generally on average under 2 weeks. And for emergency care, we're mostly able to see an emergency within the same day. So we're there for Canadians. Whereas, ophthalmology is looking at possibly some difficulties in being able to manage the demand for care looking into the future. So, we have the training. The patients need this type of care. So that's why we feel that it's very important. It's also why you see so many provinces looking to enhance that scope. It's coming from, a pressure from the patients and, a difficulty in accessing some of the care that they need as well. That's creating that type of demand. And we know that we could fill that gap.
Yeah, absolutely. I think that's such important data to have and understand the trends that are occurring in the workforce and where that's going to leave ultimately our patients, if they're unable to access the care that they need. And I think you're absolutely right. Looking back, if we didn't have the optimization of scope 20 years ago or whenever it was for us to allow dilation or treat, simple ocular surface issues, ophthalmology would be overwhelmed with some of the kind of the simple things that they really don't need to be seeing. And I think we'll probably think the same way about a lot of the stuff that we're going to be able to treat shortly as scope modernization occurs. We'll feel the same way in about 10 years. Like, can you believe we used to send Chalasia to ophthalmology? Like, how much time have we freed up for them to treat the aging population that needs their specialty care and services in those other areas? Again, as I say off the top, I'm always grateful for feedback I get from listeners of the podcast. And, I received a message from an optometrist who's practicing in BC. And, they messaged and said, I've been practicing in BC for over 30 years. So I've seen a lot of changes, and when I started practicing, there was no diagnostic, there was no TPA, there was none of that. You look in the eye, and if you see a little bit of even mild modeling of the macula or early AMD, you got to refer that off, and even then the ophthalmologist couldn't really do much. There was not a whole lot of treatment available, even if it was more advanced. They might do a little bit of laser or something potentially at that time. But it's just interesting how much they had to be sent off to ophthalmology. And at the time, with the population as it was, ophthalmology had the bandwidth to see some of those more basic cases. And now they, certainly I can imagine they don't, and they probably won't have the bandwidth in the future to see some of those simpler things that we could take care of now. So really good, really good. Any other thoughts? I know you were going through a list, and I cut you off earlier of ways
That's
that
okay.
CAO
There's just one more point is that it kind of expanded on what we were talking about at the beginning, which is collaborating with our U.S. counterparts. So one of the things that CAO does is really stay engaged in both national and international stakeholders. Yeah. So on a national level, we sit on collaborative group coalition called the EHPC, Extended Healthcare Provider Coalition, that includes dentistry, pharmacy, and other healthcare professionals. So looking at this type of thing in Canada as well. And through that, we've been able to, lobby and provide advocacy for things such as, the capital gains exemption and other types of issues that face a variety of health
Tariffs? Yeah, can you lobby against tariffs?
Exactly. Well, it's we'll see what happens with that.
We'll see what happens.
Well,
Yeah.
definitely that group would be making sure that medical devices and things that we need that we would have access to it without disrupting healthcare. So in that case, CAO would be plugged into advocacy on that type of front as well. So for sure. But although who knows what's going to happen there, so we'll
I don't think it.
Either way, we'll be addressing that both internally at CAO and through our stakeholders. But getting back to scope, one of the other groups that we collaborate very strongly with is the AOA, the American Association of Optometrists. And we go to their meeting. We, as president, I've had the privilege of addressing their House of Delegates, being in their presidential forum, which is a forum for all the state presidents to join before their meeting and do something similar to what OLF is. But they bring Canada, and we give the Canadian update there as well, and collaborate with them on issues such as scope as well. So very strong ties. And what we were able to do is send some of the CAO staff to their state government affairs committee, who provides resources for, as part of the AOA, to be able to provide resources to state associations. And, looking at all that data, they're able to bring that back and provide resources based on the US experience, but tailored for the Canadians. So having that type of data available, that playbook available for provincial associations to use. So tailoring what's happening in the US for a Canadian optometry.
Yeah, that's great. That's really great that you guys are plugged in that way too, right? You were bringing Americans, our colleagues up from the States to discuss here. It's great that they're doing the same and bringing our, leadership down to the States to really help to understand what's happening for us here in Canada as well. That's all really amazing. I wanted to go back to the training, the advanced procedures course and training at Waterloo, and you yourself have been through it, and you mentioned that you made it a priority for CAO leadership to go through that training. I'd love for you to share with us, what it was like for you, how you felt after, confidence level with the procedures, all of that type of thing.
So that's great. And like I said, it's a really wonderfully executed course. It was both exciting, engaging to go through. Really highly recommend that. It gives a lot of CE credits. I think somewhere along the lines of around 35 or 40 CE credits. So if somebody's looking to do a CE, this is a high quality one that really kind of pushes you as well. But what going through it and as amazing as what it is, and it was great to see how organized it was, the quality of the instructors and the way that it was organized. What you kind of realize is that this is definitely in your wheelhouse. It involves using instruments, like fine instruments that we would use to remove foreign bodies, Gauss-Blood Jugular forceps, but translating that, same type of handheld instruments for chalazion removal as well. But we do have the dexterity, having done those procedures, and then using the slit lamp, doing gonioscopy, things that we are highly trained to do. And integrating that. So, the laser is mounted on a slit lamp. We all know how to focus a slit lamp. So you realize that it's not a big jump from what we're doing already. We're already focusing on, the lens when we look, at the state of PCO and the intraocular lens. Anyway, we're focusing the slit lamp on that. Right. We're focusing on the iris to look at any anomalies there as well. And we're doing gonioscopy to look at, angles of our patients. So, those are really the skills required And then we're also making the judgment on, treating these patients. If you see an angle that's narrow, that's, at risk for closure, you're the one that's, diagnosing it. And right now in Canada, referring it, but you're making that call as an optometrist. You're the one saying, hey, I'm checking out the angle in gonioscopy. It looks maybe a little tight on the slit lamp, but looking at the angle, I'm seeing, posterior trabecular meshwork in 360 degrees, or not. And then, you're referring for an evaluation as well. So, the clinical decision making is being done, or same thing with PCO. It's you that's seeing the acuity that's being affected. You're looking at the intraocular lens capsule and seeing that PCO. So it's the optometrist making the call basically to refer for treatment, or if this is clinically significant and needs treatment or not. And then, just so the clinical decision making is already being done. We have the training for that.
Yeah.
Now it's just applying the instrumentation, the skill, which is things that we're already used to focusing on as well. So that was kind of, for me saying like, wow, this is really would be very, very easy to integrate into our type of practice as is. Right. So that was, kind of very much. And I think a lot of people that went through it said, this is really in our wheelhouse. So I think that was kind of a little bit more of like, hey, yeah, let's get on board. It was motivating. It was fun as well. So it's just also nice to be with other types of practitioners that are looking to, get a little bit more involved and come to these things for those types of courses. And you're spending, a couple of days with them. So I always kind of like that type of training that, you're learning along with other people. So that's also a great aspect as well. So
that's
once
true.
again, a little shout out for that course and the amazing job that Waterloo has done with that. It's a super, super high quality. But, there's other courses available as well. The Oklahoma course, they're all super, super high quality. So yeah, I think I would say, if you haven't done it, whether your jurisdiction is advocating for scope or it's not, it's just really, really an interesting course, and really provides a little bit more insight, even if you plan on eventually not doing these procedures and just referring to either an optometrist colleague who does it or an ophthalmologist who does it. It really gives you an inside look at what's going on with these procedures, the post-operative care, the pre-op, everything that your patient will go through. So when you're talking to your patient about these procedures, you have a really, really, strong grasp of what exactly every detail of it entails as well by going through the actual process of it. So couldn't recommend that course more for any practitioner as a source of excellent CE.
That's excellent. I didn't realize there's that many CE credits. Okay, that we only need 20 per year, and we can't roll over, unfortunately. So that's too bad for us. But it still seems like it would be very worthwhile. And, I've been hearing that really, really positive feedback I've spoken to at least 5 people who've been through it. And, everybody's given very similar type of feedback at how good they felt afterwards, how confident they felt. Also, the fact that it felt so natural, because it's a lot of the stuff that we already know how to do and the technology or the equipment that we already use. So it didn't feel unnatural and like we're doing something that we shouldn't be doing or have never done before, actually, which was actually the thing that really surprised me. I think it was Dr. McIver who said it to me the first time. She's like, this is not new for you. You've used a slit lamp. I was like, oh yeah, that's right. And then I'd talk to more people. I realized they were giving me a lot of the same kind of feedback. So, we're going to take a little bit of I really appreciate all of this insight into scope optimization and the training and all this kind of stuff. We got a few minutes left, and I know we want to talk a little bit more about CAO a bit more broadly. But before we do that, there's one other not quite controversial, but almost controversial topic. And, a little bit of controversy builds a little bit of intrigue. So it's probably not a terrible thing for us to talk about it. But one of the questions that comes up generally is like the conversation of equivalency. So in the States, there's the NBEO board exams. And in Canada, we have the OBEC. Is that correct?
OEBC.
OEBC, Canadian board exam. And they're not the same exam, of course. They're different. And currently, there are some provinces that allow equivalency NBEO in place, essentially, of the OBEC.
OEBC, yeah.
Oh my God, why do I get that mixed up? OEBC, instead of the Canadian board exam. So, and BC is one of those provinces. So, I know that there's some concern about that. There has been for years. Canadian optometrists feel that perhaps it's not appropriate to have the NBEO be our equivalent exam to become, to practice in Canada, to become, what's the right word I'm looking for? Just
licensed or
licensed. Thank you. To be able to become licensed to practice in Canada. Now, I wanted to, if you had thoughts to share on that, especially now we're talking about this training. You mentioned Oklahoma, for example. I'm sure the training program there is incredible. It's thorough. It's high quality. But then I know there'll be some questions as to, like, is that the same type of training that we need then to come back and practice in Canada, or is that training tailored more just for U.S. Practitioners? So I wonder if you have some thoughts on that. And I'll say this, you don't have to say it, but of course, that given with some of the controversy that's happened with NBEO recently, I think this conversation is extra top of mind right now. And I know there's a lot of people who are affected by. In fact, I know some people personally, students that I've been talking to recently who are Canadian students down in the States who are affected by some of the issues, politically correct terminology here, with what was going on with NBEO. So I know that's a bit of a broad and large question, but ultimately equivalency is the topic that I wanted you to touch on, if you could.
Yeah, and I appreciate the question. And just as a disclaimer, CAO isn't a regulatory or licensing body. We're an association. We're there to advocate for the profession of optometry and optometrists and our patients. But it's not CAO that determines who gets a license or not. That's generally a provincial regulatory jurisdiction, which is why some provinces may allow the NBO. However, as the CAO and as we're looking at Canadian optometry, I think it's important to think about exactly that. How we get licensed, what we want as a standard for our licensing here in Canada, and whether it's important to have Canadian-made, Canadian-administered, defensible, sustainable entry to practice exam that's uniform for our country. And whether that be to make sure that it's bilingual, which the OABC is, whether it reflects current practice conditions in our country and is able to evolve as the scope, the breadth, the width, the type of practice that we do here in Canada evolves as well, or looking at particular Canadian, ways that optometry is practiced in different jurisdictions, to have that available, but also to create uniformity for students. It's maybe confusing whether to know, like, okay, well, if I'm in this school, do I just need to take one board, or do I need to take two boards? And if I'm coming back to practice here or there, so to have that simplicity and universality for an entry to practice exam would be beneficial. And it's our position that jurisdictions should support one entry to practice exam that's bilingual, that's Canadian made, that's Canadian administered, and particularly because the OABC allows for Canadian input and relationships with the regulators. Whereas if we're relying on another jurisdiction to craft an entry to practice exam, while you could keep on evaluating it, there's no way to, NBO is not necessarily going to, sit down at a table with, the 10 provincial regulators and, discuss feedback for it. Whereas the OABC is to make sure that that exam reflects the type of regulations and practices is. So having that Canadian involvement, that Canadian oversight is critical to making sure that the entry to practice exam evolves. Now, that's not to say they both don't do a great job in administering an exam. I know there's, like, as you mentioned, there's been some issues and some difficulties on the NBO side. But I think overall they could create a defensible exam for entry to practice that's tailored for their jurisdiction as well. So I'm not diminishing any things on the quality of the exam of NBO, but having one that's made for and developed in Canada for Canadian practice, is important for our profession. It sets a standard. We want to have that. Looking at a healthcare practitioner point of view, having that standardized model is only a plus when we look at the profession of optometry. So
Yeah, I think that's a really great point. I never really thought about that, to be honest with you. I just thought, an exam is an exam, and if it checks my competency, then it's good to go. But having an exam that's kind of for Canadian optometrists who practice in Canada, I think that's very important. Moving forward, I'm sure there's going to be some interesting discussions on that. Be looking out for that as well. But thanks for commenting on it. I know it's sort of a tricky, you got to kind of dance around that a little bit. We don't want to be too opinionated, and you have to have a certain particular stance from the CAO. So, but that's still very insightful and helpful. Thanks, Martin, for sharing that. So last thing I want to move on to is talking about other important relevant things that CAO is doing, and dates and events we want to look out for. Anything else you want to share on that front?
Yeah, thanks for the opportunity. So first of all, I'll just appreciate the opportunity to give a platform to CAO. We're there beyond whether advocacy at a federal level, with the awareness of eye care, the role of optometry, to supporting provinces in their jurisdictions, and what they're doing, whether it be working with provincial associations on scope, on other advocacy efforts that they're having as well, and being that resource of support is one of the top things we do. But on our end as well, we're working hard on, for Indigenous eye care with NIHB, refugee eye care with the IFHP, also with insurance plans and vision benefits. Recently, we've had a successful breakthrough with Medivy, which now covers things like vision therapy and imaging and partial exams, emergency care. Things that when you look at vision plans, generally it's one exam every 2 years and a set of glasses. Well, that's not what optometry is anymore.
Right.
We do things. So changing those plans to reflect what it is something we're working on. We've had recent successes as well.
That's great.
And I don't want to spend a whole bunch of time here given my CAO presentation, but one of the great ways that you could get a little bit more involved with CAO is by attending our Congress, which Harbir, you were at the last one in Quebec City. So that it's really an amazing event that brings together optometrists from across the country. There's excellent CE. There's social and networking events throughout the day, but also every evening, high quality lecturers, food, entertainment, etc. And this summer, it's going to be out on the East Coast in the Maritimes in beautiful Halifax from July 2nd to 5th. So if you have been to Congress, you know what it's about. We're looking forward to see you back there. And if you haven't, though, this is a great way to go to a conference where you'll have so many peers and able to discuss some of the topics that we've been discussing today on the podcast. Get to the CAO AGM and hear a little bit more of what we do throughout the years and for the profession as well. And just a wonderful opportunity to connect with your peers. So that's July 2nd to 5th. The registration isn't open yet, but we know that people like to plan for their summer a little bit in advance. And sometimes with hotels, it could be a little bit. So if you go to the CAO website, look at Congress, there is a link where you could pre-book your accommodations.
Oh, that's good.
As we get ready.
Oh,
and then
excellent.
The official registration for the event will be up in March. So I want to plug that, and it's one of my favorite CE conferences. I know I'm biased, I have to say it, but at the same time, I do sincerely think that as well, because it's such a nice way for so many people to get together, and Canada has, I think, such an amazing optometric community. So to be able to be part of that vibrancy as well as have that great education is really a lot of fun.
Yeah, absolutely. I want to just, if I can just share my 2 cents on that one. I've been to one, which was in Quebec City now 2 years ago. Well, a year and a half, but it will be 2 years ago by the time the next one happens. Is it still every 2 years? I know there was one period where I think we did it an extra.
Yeah, we had to, we had one that was canceled because of COVID. So we did have 2 back-to-back in St. John's, Newfoundland, and then Quebec City. But generally it's every 2 years.
Every 2 years, which I feel like is another reason to go, right? Because it's only every 2 years. which makes it a bigger event. More people will attend. The conference itself was amazing when I was in Quebec City. It was an excuse to check out such a beautiful city. Quebec City, if you haven't been, oh my God, beautiful city. But like the same could be said about Halifax. I've never been, but I've only heard amazing things. I've been wanting to go to the Maritime. So it gives me an excuse to go out there. Unfortunately, this year I won't be there because, as I told you, it's my dad's 70th birthday that weekend. So we're going to be celebrating for him here. But I'll be there 2 years from now, hopefully. But I would encourage anybody who hasn't checked out the Congress, please do check it out. Great CE, great colleagues, great conversation, and a beautiful venue. So definitely worth your time and travel. Make a little vacation out of it. Go ahead, book your hotel right now, right? Book it for a week. Go to Congress for a few days. Enjoy your time out there. I think it's going to be amazing.
Absolutely. Yeah, definitely. And I look forward to seeing everybody there. It's going to be a lot of fun.
That's awesome. Anything else, Martin, before we, thank you, before we get to wrapping up, but thank you for sharing so much amazing insight on scope and all these other things, and helping us understand better how CAO advocates for us and supports us as members of the association. Anything else you want to share with us about CAO or in general optometry?
Yeah, I actually want to thank you, because I think that, as much as, the associations, the CAO, BCDO, the OAO, and all the other Alberta, SAO, looking to expand scope, that, what's really important is to get the members, to get the optometrist community excited about this, and I think you're just doing such a great job of bringing that excitement to the community. So that really motivates us on our end to do it, and we see people like you getting involved, having these guests, sharing it with the optometric community at large in BC and Canada wide on your platform. It really is kind of getting optometrists excited about where the profession is going, and you're just doing an amazing job at it. And we're getting a lot of feedback from the optometric community who are getting a little bit more interested. So that's an important part of any type of advancement, as well as is having that excitement and preparation from the community. So really want to thank you for playing that role as well, and being such a amazing advocate for the profession and optometry as a whole.
Thanks, Martin. I appreciate that. I'm really grateful for that comment, and I'm always happy to do it. I think just in general, if we spend all this time going to school and all this money on our education, and if we're not trying to make our profession better, I feel like that's all going to waste. So, and of course, thinking about the long term of the students who are coming up and spending even more money on their school right now, and potentially even more depending on what extra tariffs and taxes and things may be applied in the future. We want to make sure that it was worth their time, and we don't want our profession to just slowly dwindle away because we haven't been doing the right things to support it and building a strong foundation. So I'm happy to do my part. I'm grateful that I have built this platform that can help us share some of this information, and I'm happy to continue doing it. So thanks for coming on. It's because you give me the faith and you come on here. It helps it makes me look legit. The president came on. Wow, the 2020 podcast must be decent. So thank you. It's definitely a mutual respect and admiration. I appreciate it.
Yeah, thanks so much, and look forward to being back on, and look forward to continuing the discussions with yourself and anybody who wants to have those discussions with CAO.
Absolutely. So absolutely. Anybody else out there who's listening, watching, especially Canadian optometrists, reach out to the CAO. Please try your best to help support this grassroots effort to reach out to our MLAs to help share important information about what optometry is. Again, they might not even know what we do as optometrists, but what are we trying to ask for as far as scope modernization, and how, again, going back to Martin's point, is how can we support their constituents, because that's ultimately what they're looking to do. And so we can only share that information by reaching out to them. So check out the resources that CAO has, and check out the resources that your provincial association has, and let's all kind of pull in the same direction and help our profession to be stronger. So thank you again, Martin, and thanks to CAO for everything they do. And thank you to everybody who's listening and watching to the 2020 podcast, Canada's #1 optometry podcast. See you guys in the next episode.